Thank you for your introduction. Dear colleagues, I'm pleased to present you today 3 cases of subluxation of the elbow joint in cattle. The first case is about a 3-year-old, 7 months pregnant Red Holstein cow with a body weight of 580 kilo, came back from pasture, highly lame on the right front limb, 3 days before admission. The second case is about a 2-year-old Red Holstein cow, 1 month postpartum, with a body weight of 540 kilo. Was in heat 1 day before admission and was separated from the herd to minimize the risk of injury. And as the owner takes her to the other stable, the cow fell down on both carpi from the resting area on the freestyle alley and was then highly lame on the right front limb. The third case is a 9-month-old Holstein Friesen heifer with a body weight of 260 kilo, was found in the stable acute lame on the left front limb 12 days before admission. All 3 animals were presented to the veterinarian, but the lameness origin could not be found. They were all pre-treated with ketoprofen, but no improvement of the lameness did occur. They were thus referred to the hospital for lameness examination. I want to thank here Professor Steiner for placing the third case to our disposal. All 3 animals showed a mixed lameness, grade 4. The first cow showed a drop-down elbow, a slight flexion of the carpus, and did bear weight partly on the fetlock. The 2 other animals show a distinct complete discharge of the limb at rest, an abnormal adduction and outer rotation of the affected limb. A slight effusion of the humeroradial joint was palpable in all 3 cases, as well as a distinct pain reaction by palpation of the elbow. An overloading of the contralateral limb was also present. In this video sequence taken during the lameness examination, you can see the heifer showing a complete discharge of the affecting limb at rest. In this next sequence, you can see the distinct pain reaction by palpation on the elbow joint. At this point of the examination, the lameness origin was localized to the humeroradial joint. In addition, for the first case, there were signs of a radial nerve paresis. Septic arthritis, fracture, or subluxation of the humeroradial joint were our differential diagnosis. A P3 fracture or double sole, also causing severe lameness, were ruled out during the lameness examination. Our next step, ultrasonography of the elbow, was performed. Here the ultrasound images of the second cow. Clear visible is the lateral displacement of the radius, as well as the shift of the humeral condyle medially. Also visible or not visualized in these images was medially. We couldn't see any intact collateral band, collateral ligament. To confirm our diagnosis, craniocaudal and lateromedial radiographs were achieved. On these 3 lateromedial radiographs, an abnormal widening of the joint space was clearly visible. Additionally, in the first cow, a bone fragment was visible, dorsal to the humerus condyle. The same for the second cow at the tip of the anconeal process. Visible on the craniocaudal radiograph is the lateral subluxation of the radius. as well as the medially open up joint. Additionally, a second bone fragment is visible on the radiograph of the first cow. Additionally, we can also see that the onconeural process is still in the olecranon fossa. The X-rays confirm the diagnosis of a lateral subluxation of the radius in all three animals. Luxation or subluxation is a rare condition in cattle, but some descriptions are found in the literature for the hind limbs as well as for the front limbs, but for the elbow, there is no information available and the therapy is not described. In horse, there is some case reports available. When 1 month-old foal, conservative therapy was not successful, surgery ended with wound infection. Origin of the luxation in this case was not known. A forceful abduction of the leg is discussed as cause for the luxation. In the second case, an 8-month-old mule with cranial luxation of the radius, conservative treatment was successful, origin unknown, rising from lateral recumbency while the front foot of the upper leg is under box door, and trauma to the olecranon from a kick or a fall are discussed. And the last case, an 8-month-old with a craniolateral luxation of the radius, close reduction was not possible, went on surgery, had a good result despite implant failure. The trauma was seen by the owner. The foal fell down on pasture following his mother. In small animals, often a luxation is present, the closed reduction is well described, and an open reduction is only done when the closed reduction is not possible. In small animals, as I said, where a luxation is present, the aim of the reduction is to replace the onconeural process between both humeral condyles. 2 steps are described. First, a flexion of the elbow and inner rotation of the antebrachium is done, followed by a slight extension of the elbow, an abduction and inner rotation of the antebrachium with simultaneous pressure on the radial head. This technique was successfully applied in all 3 cases. On this video, we will see the whole reduction process. First, the pain reaction. The cow was brought to the surgery room, placed to the table, anesthesia, sedation was done and prepared for anesthesia, induction of anesthesia and intubation on the table. And then you will see the reduction. You see an abnormal lateral shift of the leg when the elbow is flexed. And now we'll try to reduce. Best is to hold the leg with one hand on the flexed carpus and one hand on the fetlock. Pressure is applied first on the radius, and it was not successful, so we try to repeat again with pressure on the olecranon. And you will be able to notice when the joint is really in the normal position. And now a normal flexion is possible. To understand a little bit better the procedure, we did an animation with our vet communication section. First, overview of the luxation as it was in all 3 cases. We did first flexion of the leg, inner rotation, and pressure on the radius head or the olecranon. In the following video sequence, we want to show you an interesting consideration with this fresh bone specimen. It is impossible to bring the joint apart, applying lateral force, but when a forced flexion is applied, the joint goes apart on its own. In the same way, it is impossible to bring the joint together again without holding the two bones in flexion. The short-term follow-up was uneventful. The animals were able to be raised quickly. The first cow recovered completely from the nerve paralysis. Control radiographs were achieved and didn't show any remarkable changes. The animals were discharged after 47 days, 21, and 10 days, and had an overall rest box for 2 to 3 months. Weight bearing in the heifer after 5 days. A light lameness is still visible. In the second cow after 17 days, also light lameness still visible. We did a recheck examination for all animals. 1 year later for the first cow, 7 months later for the second cow, 9 months later for the heifer. All 3 animals were kept normally and didn't show any residual lameness. On the control radiograph, mild arthrotic changes and mineralization at the level of the medial collateral ligament were visible. The video was recorded last week during recheck examination showing the second cow totally sound. Here you see the control radiographs where visible the mineralization at the level of the medial collateral band, also visible in this radiograph here and here. To conclude, a clear diagnosis at first sight was difficult to set. All animals showed a severe mixed lameness. Pain was provoked by palpation at the level of the humeroradial joint. 2 animals showed an outer rotation and an abnormal abduction of the affected leg. Lateral subluxation of the radius goes along with a rupture of the medial collateral band. In one case, also the lateral one. Manual reposition without external help is possible in all animals. A trauma that causes forceful flexion of the joint could be at the origin or an important part of the subluxation, and flexion is probably also an important step for the reduction. On the basis of these 3 cases, conservative therapy is successful in cattle, this without too much time, effort, and difficulty. A reduction under deep sedation or short narcosis should be possible. We had a good long-term prognosis in all 3 animals, no residual lameness was present, and only few arthrotic changes. Thank you for your attention.